Thank you, Laura. You can watch that entire conversation on the Our Land YouTube page or listen to it on the New Mexico in Focus, the podcast, available anywhere you find your podcast. Now, let's return one last time to our line opinion panelists to talk about Medicaid. Now, nearly half the state is covered under the federal health program, and elected officials in Santa Fe are considering approving a bill that would further expand New Mexico's Medicaid coverage. If House Bill 400 is approved, eligible residents who do not qualify for full Medicaid coverage and whose household income is 133% above the federal poverty level would be able to apply for low-cost coverage. Now, under the bill, the state would also fund a 2-year study on the proposed program's effects. Now, following that study, the program would be opened in 2026 for residents to enroll. Now, Martha, in a state that's already struggling to keep its doctors, we've talked about that at this table a lot. Is New Mexico ready for a Medicaid expansion? Let's just focus on docs here for a quick second. What's this do for the medical industry? I mean, it's great for the consumers, certainly. I see where the governor's going with this,
but it puts additional pressure on the medical community without question. And when you say great for the consumer,
right.
I'm not sure about that, because it's hard right now. Call up, try to get an appointment
right.
with your PCP, so
That's
to
right.
speak, your primary care provider.
Yep.
Yeah, you can have an appointment 6 weeks from now. But the other side of it is, what about the folks that can't get an appointment at all because they don't have the money to pay for one?
Right.
So it's a two-edged sword. As I understand what we're talking about right now, it is not jumping into the expansion right away. It is just studying about the possibilities, good or bad. And as I think I've just pointed out, there are a couple of problems on either end.
Right.
So I'm glad to see that it's going to be studied first, at least.
Tom, I got to ask this straight up. Does this reopen a door for the estimated 85,000 New Mexicans who lost their Medicaid coverage in January? I mean, that was a big deal. We talked about it at the table here, too. That's a lot of people.
Oh, it is a lot of people. And yes, this would provide a pathway forward for additional health care or access to health care. You know, what kind of raises a question with me is this government pushing more government for the sake of government, or is it using the 80,000 plus people as a reason to move it forward? You know, I think that it's okay, because in essence Medicaid is just insurance, and Medicaid, the insurance aspect will allow more people to get access, and all it does is really it distributes the focus from the University of New Mexico Health Sciences Center and all the other county health programs to the larger populace and stuff. So in essence, this really does relieve a lot of the stress that UNMH currently sees.
That's a good point there, too. It's interesting, the different angles here when you get under the hood. How can lawmakers, Ed, find a way to attract more medical practitioners if, in fact, the study goes through? We want to do this in 2026. That's not that long from now. How do you, is it money? Is it, how do you get around the Medicaid thing for a lot of docs that don't want to deal with this?
And we have to be careful with the unintended consequences of this bill and this action, right? Because we are losing doctors. We are losing doctors for a whole variety of reasons, and a lot of it has to do with our insurance policies and that in which we require medical practitioners to have. We're losing that for that reason. Will we lose more as we continue to expand Medicaid? On the other hand, is healthcare a right? Do we look at those people who are struggling and don't have access to healthcare? So we need to focus on them too. I mean, and maybe this moves New Mexico maybe a little closer to this idea of universal healthcare for everyone. I know nationally that's been worked on, but as it stands now, over 50% of New Mexicans are on Medicaid. 70% of all births in New Mexico are Medicaid. So we're getting real close to that anyway. So let's take a look at this and see how we can make it work for doctors and the consumer.
I like the way you put that as a point Ed just made. According to a 2022 study from research firm Perry Undum, half of New Mexicans, guys, forego healthcare services because of cost. Half of us. That comes around, Tom, to haunt everyone. The system's going to end up with those people anyway at some level, and that's going to be a difficulty. Now, as lawmakers consider expanding future Medicaid coverage, the governor's office has halted the state's procurement process for contracts to run the state's Medicaid program. The Journal reports the governor's office is concerned about a possible disruption of services when contracts expire at the end of the year. So, Tom, the question remains, why would the governor's office choose to halt the state's procurement process if that's a concern?
Yeah, and obviously only the governor's office can speak to that.
Truly.
Medicaid, when you look at it, where it fits into the big scheme of things, is that in order to provide broad-based statewide health care in the state, you have to have a part of the Medicaid pie, for lack of a better term. Without that piece of the pie, doing business in New Mexico and providing non-Medicaid services is very difficult, still possible. There have been some of the approved providers have been in that position before, and they've done well, but they would really like that piece of Medicaid pie. So, the fact that this was like pulled in the 11th hour and the amount of investment that has already gone in, I mean, this does not pass the optics. It does not pass the smell test. It doesn't pass a whole lot of stuff. And there should be a lot of protest, and I'm sure there will be.
Interesting point there. And Martha, let's get down to some names here. The current provider, Sky Community Care, was not included in the state's final list of recommended providers. None of us know why that is, because again, as Tom mentioned, we're not privy to those conversations. But Western Sky Community Care, a sub of Centene Corporation, covers about 87,000 people, and they came in last out of the five.
They came in last.
Right.
And what is interesting to me is that they canceled the request for proposal for everyone.
Right.
Is that a CYA thing? Because they didn't want to single out Western Skies because they like them anyway? We don't know, but these are very valid questions to ask. This company had been under scrutiny and actually gotten fined. Hector Valderas had fined them for several kinds of infractions, but it seems like to me the governor did not want to single them out, so she just canceled the whole thing. And it's bad for the people that need the services, first of all. But as Tom says, the optics are horrible, the smell test is horrible, and we got to have some explanation, which to now has not been forthcoming.
That's a key point right there. A lot of this is, we talked about this before we started taping. It's such a mystery, Ed, a lot of this. We don't know what the marching orders are. We don't know the frustration, the pain points they may have had over the years with these people. But we do know that Western Sky had to pay $13.7 million under a settlement that Martha mentioned with the State Attorney General's office after an investigation uncovered abusive billing practices. I mean, $13 million, that's a lot of money. Should we have trust in this company? After that, it's just part of the game. You never know.
It's eyebrow raising. I mean, it really is a concern. And, where's the oversight of this process? Who's responsible for that? And what is the procurement process? Is there someone taking a look at it to ensure that that this doesn't happen again?
That's right.
Is this problematic? Has it happened in the past, or is this a one-time thing? We want to avoid this from happening again because, as Tom alluded to earlier, it's quite expensive to just participate and prepare for an RFP.
That's
I mean, you're talking a lot of dollars, and we don't want to discourage potential contractors from even participating if they don't trust the system.
Right, exactly right. Hey guys, great conversation. Thanks again to the panel as always. Be sure to let us know what you think about any of the topics the line covered on our Facebook, Twitter, or Instagram pages, and catch any episodes you may have missed on YouTube, of course, but Roku on your smart TV and also the PBS app.